Hi, I'm Brad with Scarpino Life Support Training, and today I'll be talking to you about shock, recognition, and management at the EMT, previously known as EMT basic level in our EMT standards. So what is shock? Let's talk about that. So what it is, a definition, I'm going to read the slide and then explain it in my own words and the best way to understand it. Shock is a state of inadequate tissue perfusion, meaning the circulatory system fails to deliver sufficient oxygen and nutrients to meet the metabolic needs of the cells. So what does that mean? It means your body's not getting what it needs, okay? It can't take in what it needs and it can't get rid of what it needs. So it has a lot of waste product that it produces through metabolism, aerobic metabolism, anaerobic metabolism that it needs to get rid of. And when you have shock, when you're in a state of shock, your body cannot do that well. So when you have a cellular impact, cells become deprived of oxygen, leading to anaerobic metabolism and the buildup of lactic acid. Also, previous to that is pyruvic acid. So it causes metabolic acidosis. And the outcome is not corrected quickly, this will lead to widespread organ dysfunction and death. So when you have components of what your body needs, it needs three things. Your cell needs three things to actually function: H2O, water, oxygen, and glucose. Those are the three primary things it needs to actually produce energy. So we call it the HOG, H-O-G, H2O, oxygen, and glucose. When you deprive your body of one of those concepts, it goes into a state of anaerobic metabolism typically, okay? That's without oxygen. That's another reason why when you are lifting or doing heavy weight lifting, you need to breathe. Through any exercise, you need to breathe to provide your body and your muscles with that oxygen, okay? Okay, so we have the perfusion triangle, or things that actually cause perfusion issues. You have the pump, the pipes, and the fluid. Okay, or the volume per se, okay? So the circulatory system requires three things to be intact. Failure of any one can cause, you guessed it, shock. So when you have the pump problem, that's the actual heart. The heart beats, pushes blood out of the left ventricle, and perfuses the rest of the body through the ascending and descending aorta. Okay, it goes out there and goes into the smaller arterioles, arteries, capillaries, etc. Okay, so causes of pump issues could be a heart attack like an MI, myocardial infarction, as well as heart failure. When you have issues with the pipes itself, it could be blood vessels. So your arteries, when they constrict or dilate, they restrict blood flow. So this one is talking about distributive shock, widespread dilation or leaky of blood vessels. So hold up your fists and make them so you can see right through the holes. Okay, that's kind of what your vessels are like. See, there's no space here, right? No space, that's good. But when they dilate, they get larger. It makes it harder for the pressure to stay equalized at the body, as well as now there's a lot of space. It becomes leaky. Okay, all that fluid, all that blood is now outside the vasculature, outside your vessels, and in the interstitial space. Okay. Another thing it can cause is, let's see here, another cause of that could be sepsis. Sepsis is a very severe systemic infection of the body. You have anaphylaxis and neurogenic shock. Those are the three main types of distributive shock. We'll talk more about that later on. Then we have a volume issue. So with the fluid levels in the body, it's either referring to hydration or blood itself. Okay, causes can be a severe bleeding like hemorrhagic. You can also have dehydration and or burns. Now you have different stages of shock. You have compensated, decompensated, and irreversible shock and death. Think about how you feel after going for a run after not running for a while. Okay, you're probably going to have tachycardia. You're probably going to have pale, cool, clammy skin, a little bit of anxiety. You're probably breathing a little faster. If you're still alive and feeling well overall, you're probably in compensated shock. Compensated shock means your body has to work harder to meet the demand of the output. Okay, your body's working harder to meet the demand of the output. Okay, so what happens is your body's using mechanisms like vasoconstriction to increase your heart rate, to maintain your BP, okay? It's trying to keep everything up. That's compensated shock. Decompensated shock is when those things start to drop. Your body has run out of the fuel now. Your body cannot keep up with the demands. Now everything's starting to deteriorate, drop, decompensate. Some of the signs you may see there are hypotension, which is low blood pressure. That's the late sign. You may have altered mental status like confusion, lethargy, weak or absent peripheral pulses, like on your radial pulses. Okay, radial pulses are where you check. If you're not sure where to check for radial pulses, give me a thumbs up. Okay, radial, that's rad. Radial side is your peripheral pulses. And then irreversible is the final stage, irreversible shock and death. Does not always mean death for the patient, it could mean death for the organ or organ system itself. Okay, so general signs and symptoms you might see. Most patients will exhibit altered mental status, skin changes, vital signs like tachycardia, tachypnea, rapid or shallow breathing, hypotension. That's the late sign we talked about. The first sign of shock is always, I repeat, per registry standards, the first sign of shock is always altered mental status. Okay, as it shows here. Okay, that does not always mean that they're going to be unresponsive or confused. You can have a little bit of anxiety and have altered mental status. That is the first sign of shock. One of the late signs you're going to see, like it says, is hypotension right here. That's a very late sign. That's deterioration. That's the decompensated shock. Okay. Okay, now let's talk about the key types of problems of shock and what we find. So hypovolemic, that is a low fluid issue. Okay, low fluids, low volume. Does not always mean blood. Does not always mean blood. Okay, because when you look at the main types of shock, there are 4 main categories at the EMT level. Okay, you have hypovolemic, you have distributive, you have obstructive, and then you have cardiogenic. Those are the 4 main types of shock that you probably will see, are the main types of categories, the main categories. A bunch of other stuff falls underneath those categories as subcategories. For example, hypovolemic is low volume. Okay, a subcategory that is hemorrhagic shock. Hemorrhagic shock is explicitly talking about blood loss. So if you have a patient that's bleeding out or they're bleeding internally and you can't see it, that could be hemorrhagic shock. Some of the signs you will see are pale, cool, clammy skin, rapid, weak pulse. Because they're bleeding out, you're probably going to have low blood pressure and a rapid pulse. Okay, some terms you might see are rapid and thready for the pulse. That means the pulse is very, very weak, but it's very rapid. Okay, when your pulse goes up, typically speaking, your blood pressure drops, and vice versa. Okay, if your blood pressure goes up, typically speaking, your pulse will drop to compensate. It's inverse relationship that your pulse and blood pressure have when you're experiencing shock. Okay, so you may see the terms rapid and thready. Thready means a weak pulse. Okay, thready means it's very weak and thin. You can barely feel it. That's a good example of hypovolemic shock, what you might feel. Remember, big category, hypovolemic, subcategory of that is hemorrhagic. Another type of shock you might see is cardiogenic. As it says here, that is a pump issue. Causes of that could be heart attack or heart failure. Right-sided, left-sided, does not matter. It could be heart failure. Signs and symptoms you might see is typical signs of cardiac compromise, ACS, patients complaining of chest pain. You may have some JVD, and if you have JVD and it's cardiogenic, it's probably gonna be right-sided heart failure, because the right side of the heart affects the rest of the body. Right side, rest of the body. Right side causes JVD, jugular vein distension, or an edema. It could cause pedal edema in the feet. It cause sacral edema if the patient is wheelchair bound or bed bound. Some different things you might see. If it's affecting the left side of the heart, that's going to be left side lungs. You're probably going to have more things like pulmonary edema, wet sounding lungs. That's why you listen to lung sounds. It's going to help you out. Okay? So if it looks like a heart attack, heart failure, it's probably cardiogenic. Now, looking at distributive shock, there are 3 main things we look for distributive shock. Okay, and if you're a Star Wars fan like I am, you know Anakin hates most is sand. Okay, S-A-N-D, sand. You have septic, anaphylactic, and neurogenic, and then those are all examples of distributive shock. So distributive shock contains septic, anaphylactic, and neurogenic, and those are all examples of, you guessed it, distributive shock. If you need to think of a good way to memorize distributive shock, everything is dilated. Okay, everything is dilated. Get rid of those markers so you don't have to see those. Okay, I'll get a laser pointer up here so you can see that now. So distributive shock, dilate, widespread dilation, infection. So septic shock, usually you're going to see signs of localized infection first, like UTIs, pneumonia. Okay, you may see in those who may progress to sepsis and then to septic shock. Another part of distributive shock you may see is anaphylaxis. This is a severe allergic reaction affecting 2 or more organ systems, or causing issues with respiratory stress, okay? But when you see 2 or more organ systems being affected, not just 2 parts of the skin, 2 or more organ systems, respiratory issues and or signs of shock, like hypotension, okay? That is anaphylaxis. They need immediate treatment, which we'll go over here shortly, okay? Let's see here. And the third one you may see is neurogenic. Neurogenic is usually a high spinal cord injury. You have hypotension, low blood pressure, or with a normal or slow pulse below the injury, okay? That should say hypertension. I gotta change that, but that should say hypertension. Okay, so you'll probably see something along the lines of high blood pressure, low pulse. Okay, high blood pressure and low pulse are very common with neurogenic injuries, brain trauma, etc. High spinal cord injuries. You may see bradycardia. This is the hallmark. It may not show yet, but it could be there. Okay, so you may see something called a slow and bounding pulse. Okay, normal pulses feel like this. You feel it hitting your fingers. Thready, very rapid and narrow and thin. And then you may have bounding. A bounding pulse is super freaking strong. It's gonna feel like it's pushing your fingers away. Okay, that's a bounding pulse. Okay, the goal of shock management is support and rapid transport. Okay, for airway issues, high flow O2 if you need to, assist ventilations. Those are things you can do. If it's anaphylaxis, administer epinephrine or assist with the administration of epinephrine autoinjector, whatever one you want to use. Circulation, if there are circulation issues, control any life-threatening external bleeding immediately. Remember, as an EMT, your first intervention per registry standards is always direct pressure. For any life-threatening external bleeding, immediately apply direct pressure, and then if you need to, get your tourniquet. Okay, direct pressure first, then tourniquet for NREMT standards. Positioning, place them on their back if you can. This should not be here. I'm not sure why this is still here. Legs should not be slightly elevated. Okay, is it on the next slide? Oh, there it is. Okay. Position of comfort unless contraindicated. Okay. Place the patient supine or position of comfort unless contraindicated. We do not raise the legs anymore. That slide was a little older. That's why I made an edit to it. Okay. Preserve the body heat. When they go into shock, the cold destroys clots. So you want to keep them nice and warm. Okay. Rapid transport. NPO, nothing by mouth. Do not give them anything to eat or drink because they may need surgery and it may cause issues within surgery where they may die. And recess every 5 minutes. Reassessment is important. If you need to do anything, I repeat, anything in the primary assessment, you will be recessing every 5 minutes. They are unstable. Okay, more specific treatments you may see at the EMT level: hemorrhagic shock, stop the bleed, direct pressure, tourniquets, or hemostatic dressings. Direct pressure is first, as it says there. Then apply tourniquets if needed or hemostatic dressings. For anaphylactic shock, you can assist administering their epinephrine autoinjector, EpiPen, or yours per your protocols. Cardiogenic shock, position them semi-Fowler position, the head elevated. Do not elevate the legs. And neurogenic shock is C-spine precautions. Maintain that C-spine stabilization. C-spine stabilization means you're holding that head and that head in the area with your arms, forearms, knees, whatever you need to do to hold it still until they have the C-collar on and the head blocks and straps are across for that long spine board. Okay, for registry standards. Okay, do not forget to do that. Okay, so shock, as we talked about, is an inadequate perfusion, lack of a good perfusion. Your thing you have to do is recognize what type of shock it is and apply your interventions as you can. Whichever ones you are allowed and allotted to do, you need to apply them. Reassess frequently every 5 minutes as needed, and then transport. Okay, if your questions are the next steps, thank you for focusing on the critical topic. Remember, rapid recognition and aggressive intervention can save lives. This is who I am, Brad Scarpino. Here's my contact info, CPR at ScarpinoLST. That's lifesupporttraining.com. Here's my phone number. You can call or text as needed. Don't spam me or else I'm going to have issues. And you can find me on Google, Facebook, Instagram, TikTok at Scarpino Life Support Training on all platforms. If you have any questions, please let me know. Other than that, have a great day.